Risk factors for myeloma, primarily in my opinion, is age. As we all age, we acquire exposure to chemicals, to radiations, to pesticides, to infections and autoimmune conditions. Any and all of them can actually trigger mutations in normal plasma cells and make them into a cancer. So as we age, we acquire this cancer. Having said that, higher chance of developing in men above age 50 and men who have some family history. There's a very small fraction of myeloma patients who actually have a genetic predisposition. Typically, they happen to be African Americans, young females who have known family members. We don't yet know what these mutations are, how to test for them, and whether all other family members need testing for it. But we do know there's a small fraction that is familially predisposed. I like to define the myeloma journey as a marathon with many uh, peaks and rises, many mountains and valleys, remissions and relapses. This slide shows you that how patients transform from an MGUS-like state to a smoldering myeloma and eventually become symptomatic myeloma. As they go through treatment options, they get into a remission, a control of their myeloma. That works for a while, and the myeloma eventually relapses. Some clinical presentation features to go through for some of the audience members here. Most common presentation for myeloma happens to be anemia. You're fatigued, tired, short of breath with minimal exertion. Two-thirds of the myeloma patients with prevented myeloma bone disease is typically severe bone pain, either in your spine or your hips. Sometimes it can involve an arm or a leg as well. But the pain tends to be unremitting, unrelenting, not relieved by ibuprofen, Motrin. It wakes you up at night and doesn't let you go back to sleep. That's the classical features of myeloma pain. Very different from the aches and pains we all feel every day as we go through life. Kidney failure can be seen in 20% of the folks. Typically, we stumble upon it as patients are seen in the hospital. And finally, high calcium can be seen in about 15% of all folks. When I see that, it reminds me it's a very advanced stage myeloma. High calcium in isolation without any of these other features is unlikely to be myeloma. Historically, we have defined myeloma as presence of a malignancy that is proven on a biopsy, either a bone or a bone marrow biopsy, and evidence of damage to the organs in the form of the CRAB. CRAB here stands for high calcium, renal failure, anemia, or bone lesions. If you have biopsy proven cancer in any one of the four, you have myeloma. In 2014, we learned that there are patients out there who have evidence of cancer on a biopsy, do not have any organ damage in the form of a CRAB, but have either a very high amount of cancer in the bone marrow or a very high amount of protein, or have MRI showing lesions that look like myeloma. If you have any one of these features in 2014 onwards, you will be declared a myeloma patient where you should go through therapy. Reason for that is that patients who have these features without organ damage are at very high risk of organ damage. We choose to call them myeloma and treat them like myeloma. Hence, the CRAB up until 2014 was slim, was 2014 onward has become a slim CRAB.